Hey there, this is going to be a really quick update because I'm about to head into church. But I did want to kind of check in, as I said in one of my posts, I think Facebook. But yeah, I've had family in town, including grandbabies. Yay. And so I have not, I've moved out of the room where I typically film. So yeah, so no makeup today, but something came in the mail before I left to head to church. I do Saturday night church because I'm not a morning girl. But anyway, it just underscores the insanity of government in general and healthcare in particular. So, and insurance. I have been on a GLP-1. Actually, it's more than a GLP-1 because it's a dual agitator. I don't know I forget what it's called. One is GLP-1 that is being agitated, and then there's another one, can't remember. Read the Oprah book, it's very good. Anywho, so I've been on that for more than a year, and I have been extremely successful on that medication. It has worked beautifully for me, not just in weight loss. I have lost a total of 105 pounds, but 75 or so since I started the medication. But more than that, it has brought sanity to the mind. The food noise has gone away. And as someone who has lived with that most of my life, like the vast majority of my life, this has been a freedom that I have prayed for decades. And now, so because I have different health conditions, insurance originally paid for it. I have sleep apnea. It's not actually weight related. It's the way that my tongue is anyway. But I'm sure the weight didn't help. But also, I have heart disease. And as we know, weight is not good for heart disease. So the medication was covered. I'm not in a financial position to pay $600+ a month for the dose that I need for my medication. So a month ago, I get an email from my insurance provider that says, as of July 1, the medication will no longer be covered, and they want to switch me to a different medication. But it's a medication I tried and I failed on previously. It did not work for me. It's not that I failed, it failed me. It did not work for me. So now I have some guys sitting up in an insurance office determining what medication I should be taking. Now, never mind that if I have another health crisis, like another heart attack, the amount of money that insurance provider is going to have to pay out to cover the expense of another hospitalization, surgery, anesthesia, all of the things, is going to be astronomically larger than the cost of the medication that I'm currently on for probably the rest of my life. That if you totaled up the cost of that to the insurer, it would be a fraction of what it will cost if I have another hospitalization and/or surgery. So it's the definition of penny wise, pound foolish, or dollar foolish in this case. It is so frustrating. Even if I had no other, what do they call it? Comorbidities, other than weight issues, which, by the way, now that I am technically no longer obese, they may not even pay for the alternative medication. But again, what happens, and I talked to my doctor about this, and she said she is seeing patients once they cross the threshold below obesity, have their medication no longer covered. And what happens is they regain weight, and they have to go through that cycle again and again and again. And what it's going to mean is the mental and emotional toll of that process is devastating to patients. So not only are you going to have health implications of a decision like this, but you're going to have mental health implications. So, I pray to God that there are not people choosing a way out of this life because of the mental and emotional weight of that kind of yo-yo, that kind of spiral. It is so frustrating. And I would just say to every person who works in the highest levels of healthcare, in insurance, we have to do better. People's mental health needs to matter, even if it doesn't have physical implications, which clearly this does have physical implications for people's lives and health. Mental health matters, and it should matter at a policy level, both in government and in business. So that is my rant for today. I'm very frustrated. I've been off my medication for 1 week. I do feel the difference, absolutely. I have some other techniques that I've employed over the course of the last year plus that have helped me. I'm a food journaler, so I track calories, and I pay attention to that every day. And but it's gotten harder in just the last week. I am pursuing other providers for the medication. I know there are online pharmacies, many of which offer discounts, and we can bring the price down to $250, $300 a month. That's a lot of money. For someone in my position financially, that's just a ridiculous amount of money right now. So I'm frustrated. I'm getting this message out. I'm not going to ask you to call your lawmakers or anything right now, but just be aware, be compassionate. When you see a large person, you don't know what's going on in their life. You don't know if they have a metabolic issue, if they have, some just their brain is basically demanding a volume of food that their body was not designed to tolerate, and they are in a constant state of struggle. So just be compassionate, I would ask you, please, and just pray that that something can be done for people like me. I do have some other options that I'm pursuing, as I said, but it's just so frustrating. For 40 plus years, I've been praying for an answer, and I get an answer, and it really works for me, and it really has changed my life. And now it's being ripped out from under me by an insurer who is not looking at the big picture, who is clearly doesn't care about me. And that's okay. You're a business. I know not every business cares about its consumers, but I will say this: they don't care about their long-term financial health. If they are kicking people off of a medication, the number of diseases tied not just to obesity but to overweight is astounding. Even cancer, it has been tied to diet and excess weight. So there's so much. And so again, penny wise, pound foolish, and putting, I would say, it's not even putting profit ahead of patients. It's putting immediate profit ahead of long-term, responsible financial management of their own company and organization. So that's my 2 cents. If you know somebody else who is going through this struggle, try and be there for them, support them, encourage them. And again, just make people aware that compassion is needed, and some sanity needs to be restored to our healthcare system and to insurance overall. All right. Thanks, y'all. God bless you, and have a great Saturday night / Sunday. Bye.